Thanks, Nick. Well, we have some new guidance from U.S. health experts about COVID booster shots. Some scientists are saying with the FDA that people who are fully vaccinated and also had COVID-19 already, so already were sickened and healed up, do not need the booster right now. This is so interesting, especially with all the controversy over antibodies. Do you need it? Do you not? Because I already had it. We're joined now by Dr. Carl Lambert. Thank you so much for being here. Primary care physician with Rush University Medical Group. Okay, so I feel like first we should ask one quick question. Sure. With so many people vaccinated and so many people who have already become sickened, when are we going to reach herd immunity? Is that like the billion-dollar question?
Oh, yeah, that's the billion-dollar question. No, I wish I could look in a crystal ball and say, by New Year's, we'll get there. But it really hinges a lot on what the general public's going to do. So that really means getting vaccinated and then talking to your healthcare provider about whether it's appropriate or not for you to get the booster. So, again, I'm really comfortable with having those discussions with patients. I know them the best. I know past medical history, all these different things that help us to risk stratify them to determine whether it's appropriate or not to actually pursue that, or we can say, hold off. You're not quite in those higher risk categories that the CDC defines.
Well, you bring up a really valid point. Again, going back to have the conversation with your doctor, the person who is your family physician, who knows your history, who has your medical file, versus just taking a broad statement from the FDA and CDC, and that's it. But it could be kind of a conflicting message to say, oh, no, you don't need the booster now, even if you are high risk because you've already gotten sick and you've been vaccinated, but we're going to watch out. But again, have those conversations with your doctor. Staffing shortages are pretty intense right now. We're expecting maybe 100,000 nurse vacancies into 2022, which is staggering to me. Absolutely. Is that part of the reason why, even though we're seeing hospitalizations down, we're seeing deaths completely decline, we're still seeing a problem with nursing, or rather hospital impacts from this pandemic?
Absolutely. I think the pressure that we're seeing from patients that are hospitalized from COVID-19, that's still occurring. And then even some of it may be vaccine mandates that some agree or may not agree with. But really, it's going to depend upon mitigating that risk and maybe even allocating services, allocating nursing staff so that we avoid other problems other than COVID-19 infections, but really patient safety, oversight of things that physician teams and such would delegate to nurses and such to make sure that plans are carried out and ensure that patients are okay no matter what they come in for.
Right, because it's not just an ICU patient that has COVID. There are many, many reasons why you would be coming into an ER and ICU.
Correct.
Okay, we want to talk about Fauci and the fact that Dr. Fauci actually said, on the record, that kids can be safe to go trick-or-treating. But it seemed as though we were concerned about that not too long ago. So why? It's not flip-flopping so much as progressive data, correct?
Correct. I think that we should expect recommendations to change as we get more and more information. So, the CDC did put out recommendations that I think are still very reasonable to follow. Trick-or-treating, I was just thinking that it's a very social experience. Families love to do it. I think fondly of when I was a kid, when I did trick-or-treating, right? I think the medical community, we just want to say to the public, just because it's something that you love to do, you still have to be careful. You still have to be very vigilant. So you still can have a wonderful Halloween, but just make sure you're following things such as wearing a mask, a cloth mask, not the mask that's with the costume.
Right.
Safety trumps style. So you want to make sure that you're doing that. Hand sanitization, hand washing is important, and then also social distancing if you're actually going to be out and about. Or if you're having symptoms, it may be a good time to talk to your doctor about whether or not it's safe for you to actually be out and about doing those things.
But it's outdoors, and I think a lot of parents were eased by that information. Like, okay, well, at least they're outside in fresh air. Thank you, Dr. Lambert, for being with us. Appreciate that. Okay.